Because we're going to go hard on into this, and that was not what I meant to say.
Just know how you are made, because we are so different.
Because we don't necessarily understand even our own bodies, and then we're expecting somebody else to understand our bodies.
A man showing masculinity is showing his desire and how much he wants the woman. And a woman showing femininity is restraint.
And size matters.
Welcome to the She Word, conversations that women rarely have, but really should. If you're joining us on YouTube, have a look under here somewhere. You're going to find the subscribe button, and I'm going to encourage you to hit subscribe right now. And if you're listening to us on Spotify, welcome to you. Also, go onto the app and hit subscribe, because we have an amazing year ahead of us. And that's also a good reason to join us on TikTok, LinkedIn, Facebook, and Instagram. And if you're one of our Patreon page subscribers, a massive thank you to you. By just subscribing to Patreon, you are doing something amazing, because 50% of our Patreon page subscriptions go straight to our partners at the Richmond Foundation to provide support, guidance, and counseling to women who cannot afford it. So huge thank you to you. All right, ladies. In this show, we are revisiting a topic that we've delved into several times already in the She Word. In season 2, we looked at women and intimacy. In season 3, we looked at women and sexual health. In season 1, we were already talking about sex. But in this episode, we are discussing women and successful sex from 3 different angles: physical, emotional, and psychological. And for this show, I have a 5-star guest lineup. Chiara Frendo Balzan joined the She Word for the show Women and Menstruation, surprising all of us with her gynecological wisdom. Well, Malta's amazing gynae is back here on this show to share her wisdom about sex. Chiara, thank you so much for being here. I can't wait to delve into this show with you. Anna Catania is a highly respected and recommended qualified counsellor specialising in the area of sex and relationships, and offers counselling and psychotherapy to individuals and couples who are having difficulty with sexuality, relationships and intimacy. And I do believe, is it your second or third time back here on the show?
This is my third time here.
Your third time back on the She Word. So you're an old timer.
Okay, yes, I like
We'll
that.
go with that. Nicola Falzon. Nicola Falzon is back for a second show. It's your second rodeo with us, isn't it? Having brought a bright spark and wealth of knowledge to the show Women and Sexual Health last season. Nicola is head of prevention department at YMCA Malta, a psychotherapist and mental and sexual health advocate. I'm staying with you, Nicola. Thank you so much for being back on this show. Did I miss anything out, Nicola?
First of all, thank you for having me back. And I'm super honored to be here with all 3 of you. Basically, I've been studying and working in the mental health field for the last 11 years with a specific interest in sexual health and sex education. Currently in my final year to become a Gestalt psychotherapist. And alongside that, I've been studying psychosexual therapy and sex education. So busy bee, but I love it.
So you're our expert from that aspect. I do have to ask you one very serious question. Did you phone Chiara to coordinate your outfits before coming to the show?
I did not. I promise
Chiara,
I did not.
Did Nicola call you?
Do you know what? This morning I was actually going to message her, what are you going to wear? And apparently we didn't even need to do that.
Telepathically.
Psychic syncing. Chiara, did I miss anything about you?
No. Well, I am UK trained and gynecologist, work in private practice. And yeah, I tend to talk a lot about sex in my clinic, because it's not about how the vagina is feeling or how healthy it is, but how do we use it? So yeah.
I love the way that Chiara, just if you didn't see that, Chiara fluttered her eyelashes when she said, I talk about sex a lot in my clinic, which was so lovely. You did.
But
you
we
did.
have to.
What, you have to flutter your eyelashes or talk about it?
Well,
I like the combination of both. Anna, look, you're an old timer on this show. Have I missed anything out at all?
Not really. This is an area I'm very passionate about. It started when I was actually working with women passing through breast cancer, and I realized how much the cancer diagnosis and treatment affects their relationships, their sexual health. And it's an area I'm very happy to be back to talking about.
I'm so glad that you are here. And I'm just going to throw this on the table just because you mentioned this a second ago, Chiara. Are we agreed that this is a topic that is vastly under-discussed?
Oh, yes, definitely.
Let's chinch into that first of all. So thank you so much for being on the table and having this discussion. I'm going to read through a couple of factors, a couple of statistics before we go into sort of the delve in deeper into the topic. So mental health has referred as the strongest influencing factor on sexual satisfaction. And that's why we're approaching this topic from 3 different angles. According to a recent survey, not only 80% of women putting their health last after children, spouses, and even pets, but 62% of women admitted to not being satisfied in their sex lives. I mean, that's a massive statistic.
It is, yes.
62% of women always orgasm during masturbation, 34% of women always orgasm during oral sex, 27% of women always orgasm during intercourse when the penis enters the vagina, 26% of women always orgasm during genital touching. As a UK British person, that was quite hard for me to get through without blushing or getting embarrassed, because we had this conversation before we came. You guys always make a mission of trying to embarrass me. I just did it all by myself. But isn't that the case? We get embarrassed talking about that. Sexual satisfaction isn't just about having an orgasm, it's about closeness and connection with your partner. According to the survey, 60% of women want more intercourse. 41% of women claim to have an orgasm during sexual activities, but it turns out that they mostly are responsible for their sexual satisfaction and reaching climax, not their partners, which is phenomenal. That's 41%. So there is a lot to be discussed and unpacked here, and I can't wait to do this with you ladies. I'm going to ask the very first question and throw it right into the middle of the table where the nuts are, which is, we've addressed this before, and I want to ask it once again. What and how do we define successful sex and a successful sex life? Because this is what we're talking about today. We're talking about successful sex.
I would say, coming from a sexual health perspective, successful sex is consensual, free of coercion and exploitation. And it is pleasurable, mutually pleasurable, or pleasurable for all the parties involved in that sexual experience. For me, this is good, successful sex, where we are aware of what we enjoy and are able to share that, express that with our partners, so that we can make sure the experience is good for us and for them.
It is actually, in these last couple of years, in the area of sex therapy, sexology, sexual medicine, that pleasure is being pushed at the forefront of sexual health and a successful sexual experience. Before, even the way we used to teach sex education in schools, Nicola can definitely contribute to this much more than I can, because it's her area of expertise. Sex education was simply about not getting pregnant and not getting an STI. And that is, we don't talk about pleasure, we don't talk about connection, we don't talk about consent. So it's in the last 5 years that we are seeing in the area of sexuality.
Sorry. In the last 5 years?
Something like that. Where we're making so much focus on consent.
On sex positivity, on consent, on pleasure. And I teach at university undergrad students, and I had a lecture last week, and they were telling me that sex education is still being taught around not getting pregnant, not getting an STI. There's nothing said about pleasure, especially about female pleasure. We have always been, as a gender, a bit left behind.
Absolutely. Do you know what's shocking? Sorry, I stopped you there.
Yes,
but
sure, go on.
We've got medicines, tablets to help the male achieve an erection and orgasm.
Yes.
But there's nothing that helps the woman. Why? Because it's important for an orgasm to happen to achieve a pregnancy. Whereas a female orgasm is only for pleasure. So there's nothing in the your face again. So there's nothing in the pharmaceutical area. You know, I'm stuck. When someone comes to me and we talk about low libido, it's so male oriented. Yes. Hopefully things are going to change. I happen to know that just before COVID struck, they were developing this injectable to help women achieve more of an arousal state that would last about 72 hours. But then things had to take a bit of a backburner.
And to continue with what Chiara's saying, we are giving men in their 50 plus years Viagra because of erectile dysfunction, because of premature ejaculation, and we're not matching that in our menopausal women.
Yeah, absolutely.
So the imbalance is unfair, and
I had never thought of that.
Yes.
Because when you describe menopausal symptoms, low libido is one of them. But of course, when we talk about men in their later ages, as you said, we talk about Viagra. We talk about Viagra for decades. It's a drug that nobody's ever said that there's possible to have medical intervention to help a woman who has low libido. And yet, if a man's taking Viagra, his partner, hopefully, is going to be able to enjoy that as much. That is, and we were 5 minutes into the show and I already have my mind blown. What? That is insane. So let's come back to defining successful sex, just like Nicola did. So you're saying that successful sex is pleasurable, etc. Carry on, just to get that little bit sorted.
In fact, I think I mentioned this in one of the programs we already did. A huge study that was done on the orgasm gap shows a huge difference in the orgasm obtained by heterosexual men and heterosexual women. It was done in the US, and 95% of heterosexual men get orgasm with each sexual activity, 92% of gay men, 88% of gay women, and only 65% of heterosexual women, which is a 30 percentile. And if heterosexual women are usually having sex with heterosexual men or bisexual men. So such a huge percentile difference.
So if anybody's watching or listening to the show and thinking they're not massively satisfied by their sex life, they're not alone.
Definitely not.
I want to just throw something before I come to you, Chiara, as well, to define a successful sex life. I'm going to throw something onto the table. We had a show way back in, I think it was the first season, with Antonella. Antonella said something that has sat with me ever since. So for over a year and a half, I've thought about this. She said, if sex is only penetrative sex, if that's the definition, then gay women, lesbians, never have sex. And it really opened my mind to thinking differently about successful sex, because I think that we've been led to believe that sex is all about penetration, the man having his orgasm, and if we manage to have an orgasm along the way, lucky us. But do you know what I mean? And that's a historical sort of inbred thought for the very reasons that you mentioned, because of procreation. Oh, Chiara, you're smiling at me. Tell me about successful sex.
Oh, do you know what? When you're saying that, I just had a little flashback from when I was working in Wales. And I used to work in an all-male team, and it was me. And we had this good practice where we'd introduce ourselves as the team to the patient before an operation. And there was this little old lady, 82-year-old lady, and she was down to have a vaginal hysterectomy. Okay? So that means removal of her uterus through a vaginal incision.
Okay.
And this is very important because we have to make sure that when we stitch everything together, not to make it too tight if she's sexually active. Okay. Because otherwise...
I know, but I'm slightly squeamish. Carry on.
Sorry. So I was the last one on the team to introduce myself to this lady, okay? And so there was my male consultant, my other male colleague, and then I went, right? And I said, I'm Dr. Chiara. I was a junior back then. And I said, I'm Dr. Chiara. I just wanted to introduce myself. We'll see you downstairs. And have you got any questions? And she told me, oh, doctor, can I ask you something? Because I was too shy to ask the other two. And I said, yes, go ahead. And I genuinely had thought that this was all covered, okay? And she told me, will I be able to have sex afterwards? I said, oh, of course, that's very important. So thank you. And I said, are you sexually active? And she told me, well, my husband has got prostate cancer. So he struggles, but we've got a toy. And he uses it on me. And she was so sweet. And when she said that, an 82-year-old woman.
Oh, bless her.
Okay. And I said, of course, love, we'll make sure that we'll have a good functioning vagina. Maybe not in exactly those words. But see, what is successful sex? And first of all, there's no age. Okay.
Yeah.
And consent. And for me, from the anatomical point of view, pain is so important. We should not tolerate pain. If there's a problem with a certain position that is painful, then we communicate with the partner. So
you've led me beautifully into my sort of first in-depth question, because we're going to touch on this right from the very beginning. Since the first show on sex in season 1, for a high percentage, sex is a topic that we really rarely discuss. And you just mentioned this lady was too embarrassed to ask her male doctors, so she didn't ask. She didn't have any idea, and she's about to go in for major surgery,
Exactly.
life-changing surgery, and she's too embarrassed to ask. So we rarely discuss it. I think you'd probably agree, because I've heard you say this as well, Anna, even with our own partners, it can be difficult to discuss. I remember one thing that you were saying about going out for a sex discussing coffee date, where you sit down and you actually make it a date to talk about sex. But we apply pressure to be instantly good at sex. And this was, again, something that came out of that very first show when we talked about it, because we don't necessarily understand even our own bodies. And then we're expecting somebody else to understand our bodies. And it's not just our bodies. And you mentioned this here. Our emotional and psychological relationship with sex is also at play. There could be trauma, ethics, religion, and so much more about the way that we approach sex. And you've just said it doesn't age and situation and pain. Pain is also an issue. So we've got physical, emotional, and psychological. And relational. So let's throw this into the table, and I'm going to ask you guys, generally speaking, in your experience, what prevents us from having a successful sex life? Whether that's with one partner, whether it's with multiple partners or whatever it is, but what prevents? You just mentioned pain.
Yes. And it is very common that women don't have regular sex, or that they just feel that it's their duty as a woman. Now, I'm talking from the gynae point of view, because obviously I have to ask, are you sexually active? Any pain, bleeding, any irritation, anything that you're worried about when you have sex? And I get the women who tell me, I don't enjoy it, but, I just do my duty. I said, and I usually say, listen, if it's a problem, then let's see how we can approach it. And I do refer to sex therapy as well. But as Anna said earlier, we need to match with the partner. So if both, because sometimes they tell me it's not a problem. And if they both on the same wavelength, then for them it's not a problem having sex once a month. It does become a problem if they try to conceive. because to conceive, you need to have sex more often, 3 times a week. And when I do say 3 times a week, I do get that expression, like 3 times a week. So it's almost like a chore now. So is that successful sex? You know, I don't go into the psychological aspects of things, but, you know, it's like I'm forcing someone, they want to have a pregnancy, they want to conceive.
This goes part and parcel with communication, right? What the frequency that is relevant for me and my partner isn't necessarily the same for any other. So there's a lot of different components towards sex in general, let alone it being successful sex. We often talk about the biopsychosocial approach towards addressing the topic of sex, especially in addressing any function difficulties, sexual
What's
function
that
difficulties. So you mentioned earlier the emotional part, the psychological part. So when we're looking at sex, there's the biological aspect. That is what Chiara is mentioning. So there's a lot of things that need to be looked at there. I mean, our body is involved in sex, so there's things that we need to keep in mind there in terms of health, in terms of function. There's a psychological aspect. So sexual pleasure is both physical and psychological. There's a huge psychological component to it. If I'm stressed, if I'm going through a rough time, if our relationship is not in a good place, these are all factors that can impinge on my ability to achieve an orgasm or my ability to feel like having sex at all, let alone then being able to enjoy it. The social aspect is the relational that Anna mentioned. So there's a lot of different factors that come into, you mentioned religion, you mentioned history, you mentioned my previous sexual experiences, how were they? What was my first sexual experience like? Was it good? Was it bad? Was it consensual? So all of these different parts build what we call a script, a sexual script, as to what is in my background when I am then engaging in solo sex or in sex with a partner. There's a lot of different components to keep in mind. So then when there's complexities in those components, there's when it's even more complicated to figure out, you know, what is the equation to make a successful sexual experience.
What if you could start your journey over? Start here and start again there. That's how life works, in a circular way. We understand the importance of circles, and that's why you are at the heart of ours. Find your way to wellness with Browns.
Let me just tap into that a little bit more. I love the phrases that you just used there as well. They're absolutely awesome. But let me tap that into it a little bit more, because I'm trying to make sure that for anybody who's listening or watching, that we can actually quantify what those experiences might be that prevent you. So even on a medical, what examples would prevent you? So we talked about a little bit about trauma. I mentioned trauma. Or you just rightly said your first sexual experience that creates that sexual script. I love that sexual script. I think that's a fantastic term. So what for any of you, what are the give me an example of what a contribution might be to that. So a real nuts and bolts, this might have happened, therefore that might change. You mentioned about if you're having a rough time. I mean, I'm assuming if you're having a bad time, I hadn't even thought of this, but if you're having a bad time at work, does that affect how you feel about sex?
Of course.
If you're having a bad time in your relationship, if you are in a relationship, if you're in a very high conflict relationship, you might be in a position that you don't want to have sex in the evening because there is so much miscommunication happening. It might be that sex is the only thing that you manage to feel connected in. So it's really multi-layered and quite complex. Nicola mentioned past sexual trauma can be a big trigger to.
So give me an example of that, because I think we use these terms sometimes and they can sound a bit ambiguous. But what might that be? What might that look like?
It can be rape, being raped at a younger age, or being pushed to have unconsensual sex when you were younger or in a previous relationship. It can be also, especially when we're dealing with trauma at the younger, earlier years, it can be a memory where you feel that your body has remembers a time where your private space was invaded. So sometimes it takes quite a long process of therapy to unearth that feeling of, I know something happened when I was younger, but I can't really put my finger on the memory. I can't really recall. In fact, as a sex therapist, I usually stop the sex therapy process and refer to trauma-informed therapy like EMDR, because we need to get to that trauma
EMDR
before.
Is what?
It's a somatic kind of trauma-informed therapy where you move your eyes and tap different areas of the body. We really don't know how it works, so research cannot and is not at a place at the moment where we know the brain function in EMDR, but we know it works. So the results around unraveling and processing trauma are very good. So we know the results are good with EMDR, but we don't know really cognitively what happens when you go through this kind of therapy. So it's quite complex, and sometimes my colleagues can collaborate with this. Sometimes you get presented with someone with vaginismus, for example, or
which is what?
Which is the inability to have penetrative sex.
Okay.
Or with very painful sex.
Okay.
And sometimes it's a physical problem. Sometimes it is a psychological difficulty coming from past trauma.
It's like a chicken and an egg.
And it
One
goes
can
hand in hand.
create
Yes.
the other, yeah.
Yes.
Is it common?
I don't know
Oh my word,
statistics.
Cara, it obviously is because that face. So how common?
I don't know statistics, but I see it often enough in clinic to tell you that it is common. And this is when I'm doing a speculum for a smear test and they clench. And even when I'm scanning, when I'm doing a transvaginal scan, so an internal scan, and I can feel that there's almost like I'm going through a wall. And this is when the pelvic floor muscles are constantly clenched. And if one is anticipating pain during intercourse, then they're going to clench those muscles even more. So the entrance to the vagina is going to be even more narrow. And this becomes a problem when people are trying to have sex to conceive. And when I examine, I can feel that the muscle it's so tight. And that's when I refer to the pelvic floor physiotherapy, because that's when they can release those muscles and the spasm.
Nicola's nodding away there enthusiastically.
This could also be one of these background stories that could lead to problems in sex, in where there was so much fear around the first gynecological examination, or an examination that didn't go quite as well, where there was some level of pain because of so much anticipation of it, that then there's fear around the touching at all of the genital area. So this is another potential way as to why somebody is having difficulties with pleasurable sex, for example.
You mentioned before something that really, again, is lodged in my mind at the moment. You mentioned before we even came onto camera, you mentioned that this trauma can be triggered by a smell, a sound,
Yes,
or anything. So we could be in a sexual situation and we're getting it on,
yes.
and for some reason and for a reason we don't understand, we're triggered to a response that might have effect on a sexual life. Can you?
Yeah. There's a very famous book called The Body Keeps the Score. Basically, what it explains is that different kinds of traumas. There's different experiences. The book mentions sexual violence. It mentions people that have been in wars. So a lot of different kinds of trauma essentially are stored in the body. So the body remembers. And while we may not necessarily recall every single detail of that experience, our body reacts to that experience or a trigger in today as if it was the same 5 years ago. So let me give a practical example. Something completely unrelated to sex. There's this fantastic TED Talk on YouTube where this man experienced a feeling of a scratch on his leg. And the brain goes, have I experienced this before? Yes, it's a scratch on my leg. Turns out he was bitten by a venomous snake and almost died. Okay, he didn't feel any pain because his brain told him this is a scratch from a piece of bark, doesn't matter. A couple of years later, he's walking again in the same woods and he feels the same scratch. And the brain goes, have we been here before? Yes, I almost died. And he felt an excruciating amount of pain. Actually, it was just a scratch this time. But the body remembered that the last time he felt that feeling, he almost died. So this is where we're talking about perceived pain. The body really, you actually feel the pain, but there was no pain there. So then when we put this in the context of sex, let's talk about rape, for example. A very painful sexual experience physically and emotionally, right? So then I might be consenting to having sex with my partner, who I've been with for a very long time, but suddenly my body just recalls this experience unconsciously through a movement, a particular body position, a particular place, if it's an unusual place than where I usually have sex with my partner. And that pain returns. That the body responds to that.
Because we may not even be aware that that is a trigger. And we might have blocked that out and we don't even know what happened.
Exactly.
Wow, sex is complicated, huh? Good grief. Guys, throw on the table here, because I want to normalize this conversation. I want to normalize the idea that challenges in a successful relationship and successful sex is actually okay.
Super
as long
normal.
as we don't, super common, as long as we have a good approach to dealing with them. So what else may cause a challenge? I'm going to come back to you, Chiara, for physical. What are the other physical components that might prevent you from having a successful sex life? We've talked about
vaginismus is painful.
I remember you mentioning this before in the menstruation. I can't say the word.
Vaginismus.
Vaginismus, okay.
That's painful penetration.
Yeah.
And I think orgasm, funnily enough, there are women, as per your statistics, some women take it almost for granted that they're not going to have an orgasm. Yet I get those other women who feel like they should have an orgasm with penetration, when in reality, we've got more nerve endings around the clitoris. And so stimulation over there with oral sex or manual stimulation is more likely to achieve an orgasm. So what are we perceiving as normal?
Yeah.
Is also, you're frozen.
Oh, sorry, I've done it again, haven't I? Every time you sit there, Chiara, you deliver, and all three of you have delivered these mind-blowing, kind of eye-opening comments, and I just sit there like this.
Yeah, I think for having successful sex, orgasm is important. And when I was in the UK and FGM, so female genital mutilation, it's a crime over there. So it's illegal, and I lived in an area where it was being done in the communities because there was a big community that was foreign to the UK. In Malta, we do see patients with FGM, and the largest sexual dysfunction in patients who have got FGM. So FGM, female genital mutilation, would involve cutting or removal of clitoris, labia, and there's various
this is usually in a cultural...
And it's cultural.
Yeah.
And it's expected, it's done.
So it means that a woman can't orgasm.
Yeah, so anorgasmia, so the inability to achieve an orgasm, was by far, I think, was almost over 90%. And I remember learning these statistics and thinking, that's sad. That's sad. And now in my clinic, I see that this reality is still the case, and not with FGM, but in couples that have been together for a long time, and it almost is like it's the woman's duty to satisfy the man because, he's got his needs.
Yes. And what Chiara's saying is very, very relevant. And I'd like to comment on two things. We do not have, as a culture, as a Maltese culture, female genital mutilation. We get it from other cultures that are now living,
with the UK, as
living
with
in
most,
Malta.
with most European countries.
I would say we have something similar, because shame and religious shame around sex and orgasm and female sexual pleasure and being a virgin before you have a long-term relationship or before marriage is so embedded because of our Catholic upbringing, and this sometimes is a difficulty for a woman to actually experience pleasure because it has been termed as dirty, as you
still in 2024.
Yes, I that's what I thought when I started doing this work. I thought I would have older women maybe my age, but I do get in clinic 20-year-olds, 22-year-olds, 24-year-olds with difficulties in having penetrative sex, in having any sex at all, because it has been passed down from their nonna, that you should remain a virgin. And although they don't ascribe to that ideal anymore, and they're not practicing Catholics themselves, it has been so ingrained that the good girl does not open her legs, otherwise you're promiscuous, and that message then translates into you not allowing yourself to relax, to enjoy sex because it's dirty and it's
Does it apply to men as well?
Much less, I think.
But
Yes, I think it is much less to men, because women have always been termed as in our culture, as those keeping the reins of sexual pleasure. If you're a good woman, you keep your man under rein and you tell them when they're stopped. There is still that narrative.
And there's the narrative. I will continue this, and I will let you continue with your second point.
Go on.
That a man showing masculinity is showing his sexual desire and how much he wants the woman. And a woman showing femininity is restraint.
Yes.
That's the cultural approach. So
You don't
this is
see it
still
in
very
clinic?
relevant.
Well, I don't go into this, but that's fascinating because it's a mismatch.
Yes. And a woman is
sense.
expected to be a virgin. And the man is expected to show his masculinity and sow his seeds around. And
With who, if they're all virgins?
Exactly.
Yes.
The math doesn't work.
Yes.
The math doesn't work.
I thought it was a narrative of my generation.
Still exists. I think there's been a lot of improvement.
It's
and I
much
think you
better,
agree.
but
it's still a relevant backstory to multiple of sexual function problems that we would address. The shame element, first of all, is important across the board to a lot of different difficulties. But yes, this is very relevant.
But even if it's not relevant, let's say it's not relevant in a woman, a young woman or an older woman, in her new relationships, I'm seeing that it's relevant in the ability to discuss, to be open to have these conversations.
Yes.
Because I remember when in the very first show about sex, you were saying, Anna, you've got to talk about it. You've got to talk about it. And I think I'm not alone, that those conversations are not easy.
No. Especially if you're used to a home where there's a sex scene and all of a sudden everyone's looking for the remote to change the or it's not talked about, or your parents are never affectionate in front of you. So where are you going to learn this? They're not learning it at school, and I've confirmed it last week in lecture I gave. I mean, two students who 4 years ago they were in secondary school. What the stories I heard were, and it's not happening at school, it's not happening at home, not always and everywhere, and it's much, 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 much better.
But it still lacks the pleasure aspect, for sure.
Yes, definitely.
So even if it does happen, the pleasure aspect is eliminated.
And that leads me really nicely to the second point, what Nicola has just said. Sex is in our culture, in most cultures, I think, penetrative sex, intercourse. So if I get a couple in front of me, we are having problems to have sex, I am definitely, I ask them obviously, but usually they're talking about penetrative sex. And we need to move from this narrative of penetration, of intercourse, to pleasure, to sensuality. We have so much focus on intercourse. And for a woman, intercourse is really the last part. If she's not aroused enough, lubricated enough through stimulation of the clitoris, intercourse is going to be painful. It's not going to do much for her.
Or stimulation of the mind.
Yes, as well.
So another aspect is that the stereotype around sex is that, okay, we suddenly got turned on, it's a spontaneous thing, and we go and we do it. But for some people, it's the text throughout the day. It's the, I'm so excited to see you later. It's the, sexy messages. It's that build-up, that mental anticipation that then prepares the body and the mind for sex. And this is where the communication comes in, because there are different ways that people become ready for sex, both mentally and physically, and will need different things. And I want to challenge a bit earlier the discussion on orgasm, as it is super important, but sometimes focusing too much on the orgasm aspect eliminates the joy of the process. And in fact, last time I was here, I mentioned foreplay, and I want to mention it again because I really want us to prioritize the fact that there's so much more to sex than penis and vagina, penetrative sex. There's so much more to it. And you mentioned earlier as well, what about all types of relationships and all types of couples?
Talk about foreplay again, because for anybody who's not heard, I loved this when you said this before, Nicola. You were sitting here at this table and you mentioned this term foreplay. She's a humding, and she comes out with all these great phrases. Foreplay is what?
So basically, in our field, we're reframing what we commonly refer to as foreplay, which is the stages typically before penetrative sex. So this would be manual stimulation, let's say blowjobs, handjobs, etc., things that prepare the body for penetration, because that's what we're typically thinking sex will look like. But for a lot of people, these elements of sex, engaging different parts of the body, the senses, are really the core of sex, the most enjoyable part or the most lengthy part that is enjoyable for whichever part of the body or whichever person is involved. And there's also people that will enjoy giving, there are people that will enjoy receiving, there are people that enjoy both. There's a lot of different elements to foreplay and sex in general. So for me, foreplay is about putting more focus on the experience of sex in general, keeping in mind the mental aspect, the physical aspect, the psychological aspect, and not just the typical, stereotypical penetration, which penetration could also be with toys. So it still applies to, let's say, lesbian sex, which you mentioned earlier, but not the typical penis and vagina conversation.
I have like 1,000 questions from what you just said.
I need to slow down.
We are going to be here for a long time. Prepare yourselves, ladies. Take a nice slug of wine, because we're going to go hard on into this. And that was not what I meant to say. So we're going to talk about toys in a second, because Chiara also mentioned toys right at the very beginning of the show. And I think that's something that we need to include in this conversation. But going back to what you were saying there, I think it would be, is it not fair to say that successful sex is different for each individual? Yes. And this brings along a huge, complex narrative to this conversation.
Yes.
So we've started off by defining, generally speaking, what successful sex is. But for each individual, it's going to be different. You mentioned about oral sex and blowjobs and so on and so forth. And of course, as we've established on the table, for most people, they would view the end game being penetrative sex. And we're saying, okay, that's not it. Mm-hmm. That's not it. We're redefining what successful sex is. So I want to come back again I'm going to keep drilling down into this topic of what is successful sex. And I'm going to ask you to just go back to some of the points that you just mentioned, because you've blown my mind. I mean, you guys have just blown my mind again today. And talk about those different aspects, those different elements that make up this successful sex for different people.
So for me, first of all, there's the I mean, I'm going to repeat the same thing. Communication is super important. But in order to communicate what I enjoy, I need to know what I enjoy. And you alluded to that earlier, which Anna mentioned some seasons ago. So first and foremost, understanding what we enjoy and also catching our thought processes, emotional reactions, physical reactions to what's happening in sex. So we can understand better what triggers us, what we enjoy, what we might not enjoy as much. That's what we can then be able to share with any partners as to what I like and what I don't like, even in terms of details like pressure, how much pressure I enjoy, or what kind of movements I enjoy when it comes to clitoris stimulation, for example, because not every woman is going to enjoy the same pressure, speed, movement when it comes to stimulation in general. So there's the emotional component and the physical component, but it starts with you and you understanding what you're comfortable with, what you're happy to explore, what you're happy to try, maybe, that you hadn't tried before. But unless you are aware of your own sensations and are able to get in touch with those moments where something's come up for me here, or I would like this in this context, or you know what, I'm not happy to engage with sex in this particular context, I'm not going to be able to share that with a partner. So that equals not necessarily unsuccessful sex. That's what it equals, right? If it's not up to my comfort level, up to my standard, etc., etc.
I know you're going to agree with that, Anna, because you said that right back in season 1. You were talking about knowing our own
Using
pleasure.
the mirror.
Yes.
Oh my gosh.
Mirror work.
Mirror work.
We love that.
The truth is, we can't see as women our genital area. It's humanly impossible. So get out your compact mirror. And some of my clients say, I use my phone. That's good enough with a reverse camera. Obviously, be careful.
Exactly.
You don't shoot a photo and send it to the wrong people.
Suddenly she-worders are taking selfies of their vagina. But you said that right from the very beginning.
But we are made so differently. As human beings, as women, we are cis women, we are made so differently. It's really important to acquaint yourself with how your vulva look like, because we don't know how, and it changes. And Chiara can definitely say it changes with childbirth, it changes with changes of hormones and age.
Absolutely. And there are women who don't want to look at themselves. And when I tell them this, like, you know, you need to know your body, because even if you have a mole, you need to know if there's changes to it, right? So from the medical aspect, if there's changes, if there's new things, then you need to speak up. Okay, so that's to make sure that things remain safe. And when I tell them you can squat down and get your little mirror, like, no, I'm not going to look at myself. Or they use words, scusi, and like, you don't need to say scusi before you talk about sex, right? So, do you know what? I'm so pleased we're doing this show, because I'm just realizing how we do not talk about sex. How we just do not talk about sex. But yes, vulval changes, puberty, and it's not the amount of sexual partners we go through. Having stitches after labor, and the hymen, how the hymen changes and the hymen remnants. And if you get folliculitis, we get laser, all of a sudden we get laser, the labia are exposed. Sometimes the clitoris gets more sensitive because of this depilation. Yeah, absolutely. We need to
we've all agreed at the table, you've all agreed that women should be getting out their compact mirror and looking at their vagina. What are we looking for? You mentioned moles, but I'm pretty sure that we're looking for more than just a mole.
I usually tell my clients, especially who are having sexual difficulties, just look at your vulva and at your external genital with curiosity. Just know how you are made, because we are so different. You can have the inner labia, which are much larger than the outer labia. You can have...
Okay, for anybody, again, who's listening or watching who is not familiar with these terms, because if we don't talk about it, A lot of people won't know what that is.
Yes. The the labia are the lips. That's around the opening. We have two openings usually as women. We have the vaginal opening and the urethral opening from where we pee. And then obviously there is the anus, but we're talking about the genital area. And the labia are the area which covers the clitoris and these openings. Sometimes the inner labia are larger than the outer labia. And
or asymmetrical.
Or they cover the clitoris.
Absolutely.
So you need to, if you are teaching yourself what you like through masturbation, if you are going to teach a partner what you like, you need to know where to touch and to... That is why I'm seeing a smile. I'm seeing a smile coming up. That is why self-awareness and knowing how we look is so important. And as Chiara well said, it changes. It changes with childbirth, it changes with stitches, it changes...
We talked about communication. We're going to come back to that in a second. Before we get there, because I want to touch, I'm going to grill you a little bit more.
Go on.
Chiara, we talked about changes. So childbirth can change.
The body is not the same, especially with breastfeeding.
Hang on a second. Why does breastfeeding change?
Because breastfeeding causes some hormonal changes, especially with estrogen deficiency. And that makes sex after labor, after childbirth, painful. And it feels like having like sandpaper. So because of the dryness, so it's equivalent to the changes in menopause, right?
There you go. So, nobody talks about that. When you hit menopause,
why?
You get a little bit. Why? I don't know why we don't talk
about it all the time. Of course I do. But
we should have a regular Chiara tri-vagina hotspot.
Chiara dry vagina hotspot, please, Trudy, to not advertise that. Trademark it.
Oh my gosh. Yes. Excellent. So glad we said that.
Not menopausal yet. Okay, thank you very much.
But it is one of the symptoms. We've had shows about menopause, and it's one of the symptoms I don't think that we've actually discussed on a menopause show, that dryness. And that's incredibly easy to solve.
It's not just dryness.
So easy to solve.
But the skin goes through changes. It thins. It thins out.
The feeling of the vagina is very, very different. The feeling of the clitoris is very, very different.
There's atrophy. So the medical word is atrophy.
Which means?
So it's like the skin, I don't want to say the word deteriorates, but it thins, it
loses
something like
elasticity.
Yes. So apart from the dryness, and bear in mind that we tend to lose the elasticity, the collagen, and we might develop prolapses. So it's not just...
Which is what?
Where the walls of the vagina, becomes more lax, and they allow organs to protrude through. Okay, so the bladder tends to be heavy. So is the low bladder, low uterus. Okay, so that's a organ,
so
a pelvic organ prolapse.
Yes, which can make sex more painful.
Exactly. Yes. Obviously, there's mechanical supports. There's the pessary that can help the vagina not change shape, but to get its shape back. Obviously, there's surgery.
What is it called?
A pessary. So it's a ring shape. I call it the scaffolding of the vagina, because when it's inserted, it gets the vaginal skin taut. So these organs from the behind the vaginal walls don't protrude through.
Why am I hearing this for the first time?
Because we don't talk about it. Because menopause, but are we shy to talk about normal changes? Because these are normal changes. And if it is impeding us having successful sex after our periods stop, then please talk about it with your gynae and see if there's any hormonal changes, hormonal treatment that you would need, or lubrication,
Yes.
or
moisturizer, vaginal moisturizer.
Exactly.
Except that, I'm going to go back to something you said right at the beginning of the show, and that was that your lovely lady who was about to have a very life-changing operation felt that she couldn't ask her male doctors, and I'm wondering whether that's an element here, because if you said to me, go and see your male gynecologist and ask him about lubrication, I'd probably go, no.
Yes, and I think there's a relationship that one needs to have with the gynecologist in a way that it's okay to talk about these things. And when I take a medical history, as a state of fact, I always ask. And it's not, I don't want to pry, but I want to make sure that you're using the vagina in a healthy way. Because if this part of such an important aspect of being a couple, sex is important. We don't need to shy away from that. Any issues?
Is anybody else sitting at the table thinking, why, when it's such an essential part of our relationships and our being as a human, we don't have these conversations and we just try and struggle on? I knew nothing about this scaffolding that you put up your vagina. I literally have never heard of this before.
Sorry. Mm-hmm.
It also concerns me when it comes to psychiatric medication. So I'm carrying this on to a lot of different kinds of professionals. I think having a focus or keeping in mind the relevance of sexual health in all these different aspects is super important. And I'm lucky to know quite a few psychiatrists that are informed, but there's a lot of different medications that we take for depression, for anxiety, for different mental health difficulties, that a major side effect is sexual function, is vaginal dryness, is an inability to achieve orgasm easily, is erectile dysfunction, and many other desire. That's another big one. So for me, I'm coming from a position, and that's why I love working with Chiara, because we come from a position of helping clients make informed decisions about what medications they take, what surgeries they sign up for. And it's about quality of life in the end. Sometimes you need that medication to be able to get out of bed in the morning and function. But it's about being informed and aware and able to ask these questions and have these discussions around how to mediate these potential side effects.
And one other thing, the pill.
Yes.
Because there's a particular pill that we use for acne.
Yes.
That drops the testosterone. Because testosterone causes oily skin, that causes acne. Therefore, we use this pill to help clear acne, but it ruins your libido.
Women have testosterone too.
So there is a popular contraceptive pill that is prescribed not just for contraception, but it's also, I was on contraceptive pill because of endometriosis. We've had this conversation before.
Yes.
It's one of the ways of managing endometriosis. So you're put on it for that reason. But it can also be put on it for acne?
Yes.
I didn't know that. And the side effect of this very popular contraceptive medication is lowered libido.
Correct. Because it lowers testosterone.
So how often do we know about? You hear me stuttering because I'm actually in shock. How often is this mentioned? Go on to a contraceptive pill, and which in certain circumstances is so that you can have, sex without worry. But if it lowers your libido, your worries are not.
That's not how it should work as a contraception, right? not having sex. But
no, that's a very successful contraceptive mechanic. So you're suggesting that if you are on the contraceptive pill, go and you're feeling irritable or you're feeling that you're low libido, go and ask your gynae, or I'm guessing you can also do some research.
Yes. So when I do take a medical history, if someone is on one of these that I know is going to affect them, I always, because we have to do a pill review every year. The risk assessments need to be done because risks change. And and I ask any problems, any side effects, anything libido okay. But this is important. It's part of life. So
I'm flabbergasted, and this keeps surprising me that we as women, as we said right at the very beginning, have just sort of put up with this, and we are so medically in the dark for most women, for a large portion of women. I didn't know that, and I've now come off 15 years of contraceptive pill, and I know the one that you're talking about, and I had no idea. Nobody mentioned that to me. We talked about the side effects that might happen. You might gain a bit of weight, you might do this, you might do that, but that was never mentioned, and that affects one of the most important components of life and potentially your relationship.
Yes.
indeed.
Well, I feel so angry. I'm just going to share. I feel really angry, and I'm so very grateful that you've mentioned this, because I think it affects an awful lot of women who are listening or watching to this show. So ask is the answer to that. Ask. If you're on the contraceptive pill, ask.
Yes.
Yes.
Anybody else slightly blown away by this?
I am, actually. I was on the same contraceptive pill for 15 years as well. And I didn't know about that.
Just because it's popular, I mean, there's other options. There are other options and devices.
Yes.
So, yeah.
Yes.
Oh my gosh. Look, I want to just jump into we've talked about what can prevent a healthy and successful sex life. I think I was going to approach this question by saying, if you're in a new relationship and just embarking on a sexual relationship, what are good practices to introduce from the start, both physically, emotionally, and psychologically? But you know what I'm going to do? I'm going to put it on the table that we don't even need to do this when you start a new relationship. It's something that everybody could start doing right now, today in their relationship. So what is the best practices, both physically, relationally, is that a word? Relationally, psychologically, emotionally, what are good practices to get into to achieve this successful sex life?
Actually, I was going to say that before you put in the question, because sex is part of a lifestyle. It's part of our life. It doesn't happen in a bubble. It happens in a context. And usually we need to be aware that even if we're with a new partner or with a partner that we've been with forever, it is going to change. And I find, especially with couples who come to therapy, especially couples who have been in a relationship for 2, 3, 4, 10, 20 years, they want to have the sex they had in the first 18 months of their relationship. And that is impossible. Because in the first 18 months of the relationship, there wasn't the lifestyle you have today, there wasn't the age you have today, there wasn't the 2 kids and a loan and work that stresses you out. And so we need to really move from this idea that sex needs to be spontaneous. And that, especially in a long-term relationship, sex is not going to be, as we see on media, that you get inside the house and start tearing each other's clothes. Yes, if you have a 15-year-old sleeping in the bedroom near you, you are definitely not going to do that. Or if you have had a really difficult 12-hour shift, you are not going to do that. So sex needs to be planned. In long-term relationships, sex needs to be part of the week and the plan of a couple.
Okay, so let me ask you another question. Actually, do you mind if I just ask a question that's totally unrelated to that?
Sure.
Because you just triggered something in my mind. I'm under the impression, and I don't know, I could be wrong, that women prefer sex in the morning and the men prefer sex in the evening. I think we've mentioned it on the show before.
It's very individual.
Is individual, is it?
Yes.
Okay, we'll ignore that. Because I was thinking about your planning, and I was thinking of how your weekly calendar could clash.
By planning, I'm not saying put it in the Google Calendar. Once I had a couple I swear. Once I had a couple that one of the partners was sending a Google invite to the other partner.
No.
That is going to induce anxiety, especially if sex is already not happening and a big issue in the relationship. But have an idea. This weekend we're going to be home, relax, the kids are away, or are going to be at a sleepover, etc. And let's make it happen sometime during the weekend. Or we're going to be relaxed after a night out. We had a wedding, we drank a bit, we're going to be, so just put it in the plan. We plan everything. If you think about it, we plan our weeks, we plan our days, we plan the next hour. At least if sex hasn't happened this week, sex hasn't happened in a fortnight, say it needs to happen. I need to, and take initiative. We also, as females, especially in heterosexual relationships, we tend to have our partners. Why do we need permission to initiate sex if we want it? And
okay, so the first stage here that we're talking about moving towards a successful sex life is plan.
Couples don't like this. Individuals who come to therapy, I don't know if it is your experience, they think that sex should be spontaneous and we were at like, I want to be at it like rabbits, like we were in the first 6 months.
It can be, but not necessarily always. And if it hasn't happened in a long time, we need to have a different approach.
Yes.
So that's what I'm suggesting.
Yes.
Yeah.
Okay.
But I would also put into this, like, what you do to prepare for successful sex is getting checked. I mean, going to a gynae, making sure everything's okay, asking these questions. This is also an important part because our pelvic floor is also super important. There are physical components
for anyone
to
that's
it.
watching or listening and doesn't know, like I didn't know until I did a show with you, what the pelvic floor is. Once again, describe the pelvic floor, because again, the she word has been a fountain of brand new knowledge for me too. I knew that there was a term, the pelvic floor, but I had no idea what it was. What is your pelvic floor?
And correct me if I'm wrong.
Well, should we get Chiara jump in and tell us what the pelvic floor is?
Sure.
Okay.
And come back to
the pelvic floor is, so we've got the pelvis, the bones, right? And it's like a hammock. I call it a hammock of muscles that are attached from the front to the back to the sides. And so if you think about it, the pelvis has got a canal, a tunnel where the baby comes through during birth. Okay. So there's a tunnel. And this pelvic floor, this hammock of muscles close that tunnel. Okay. Otherwise our organs will fall through. Okay. So we've got at the bottom of our pelvis, we've got this network of muscles, and it surrounds the vagina canal and the anal canal and the urethra, so the pipe that leads from the bladder to the outside. So that's the pelvic floor.
Yes. And earlier, Chiara mentioned referring to pelvic floor specialist. Why is this relevant to sexual health and sexual function? Tying back to anxiety and the psychological component, when there are psychological difficulties related to sex, we can store that in our body in terms of muscle tension. So just like when I'm stressed, my back muscles are sore, and if I massage that releases. It's the same with the pelvic floor. So we can store tension literally in our pelvic floor that makes the muscles too tight, and that's partly why it could be dyspareunia or vaginismus, which are two conditions that we
and
speak
when I
about.
examine, I can feel exactly where this is. And then how I explain to the patient is, like when you go for a massage and they tell you, oh, there's so many knots here. Exact same thing. Yes. It's a muscle. So going to a female health physio will be able to release those muscles. Yeah, absolutely.
Oh, sorry, I've got that face again. Okay. So we've started off with how to achieve a successful sex life plan. Don't just throw it out there and make it We're going to come back to communication in a second, but you said go get checked out.
Yes, and that's also related to safer sex.
Yes.
I was referring to Donya's comment, but safer sex, getting checked for, any
STIs.
sexually transmitted infections, HIV.
Okay. I love it when I get women who bring their daughters women my age who bring the 16-year-olds who are going to embark in their first sexual relationship, so that they're going to have safer sex and talk about the contraceptive pill. So that's another way. Do you know what? She can go have consensual sex, and it's going to be okay, it's going to be safe, and we're not going to be worried about having any pregnancies anytime soon. So I think that's another way
really
out to, absolutely.
Yes.
And it's nice to see these, 40-year-old women bringing their young daughters.
Let's stick with you for a second before we come back. This road to successful sex from a physical point of view, apart from just getting checked out, what can we say from a physical point of view is a good way forward?
So in the initial stages of engaging in sexual activity, penetrative sex, usually you start exploring our bodies and our vaginas also by using tampons.
Okay, yeah.
And if there is an anatomical problem, such as the hymen being too thick, or if there's a septum, usually that comes, it becomes apparent in the very beginning, during puberty. And that's when I start seeing problems with the anatomy. It's a bit difficult, because if someone is afraid that is going to be painful, having tried tampons and it's difficult to remove them, then examination is going to be tricky. And I usually take my time. I don't want to rush these patients. And if there's no anatomical issue, then it might be a pelvic floor issue or a vaginismus issue, when I refer to these ladies here. But so that's in the initial stages of embarking into an adulthood and your sexual life, and then later on it's exploring what you enjoy with your partner, and everyone is different. Every relationship is different. Every sexual activity with every different partner is different.
Yes.
I refer back to the show that we had with you when we talked about menstruation. We talked about endometriosis, we talked about PCOS, we talked about fibroids, we talked about a whole bunch of very, very common symptoms and issues with women's health. Do they affect women during sex?
Yes, and even normal anatomy. Just today, actually, in clinic, I was scanning someone and I said, oh, so your uterus is backwards, so retroverted, so pointing towards the back. And I said, you don't have any problems? I said, no, but it could be that you have painful intercourse, especially the deep positions. And she told me, yes, nobody told me. And then I explained while I was scanning why this causes pain. So that's in a normal anatomy. 25% of us have the uterus that tilts backwards rather than forward.
25%?
But there's nothing wrong with that. It's just that the uterus is held by ligaments, because obviously it needs to grow, It's not a fixed organ like the heart and the liver.
Okay.
So it's held down by ligaments. And these ligaments can either tilt it forwards, hugging the bladder, or backwards. And if it's backwards, if there's penetration, it's going to be hit. The top of it is going to be hit.
So knowing that will help you make decisions around what kind of sex you have.
What kinds of positions?
And actually not to be afraid, because sex, it doesn't have to be painful. So I'm okay because of my uterus.
I'm going to refer back to the show of menstruation. You said something that was so powerful, and I have quoted you over and over again. You said, if your menstruation is more painful than cramps, if you need a hot water bottle for a period of time, and if you need to have pain medication like Panadol, etc., something is wrong.
Exactly.
So I'm coming back to you just to qualify that, following on from that, if, of course, you have PCOS, fibroids, or endometriosis, that's also going to, as well as a urethra going back. I mean, I'm just mind blown, and I'm not quite catching up with all the phrases and the terminology, but any of those could cause pain during sex.
So fibroids can cause pressure, and because they're a solid thing. So knowing that it's there and knowing how to shift position, because usually we tell them to avoid certain positions that are deep.
Like
like doggy. Doggy is a deep position.
There she
You
goes
like
again.
that?
I just wanted you to say doggy, Chiara. That's all I wanted.
And the Italian word, because obviously I have a lot of Italian patients, is pecora, which is sheep. So yeah.
Nice.
I know. You know, animals and weird. But yes. So knowing how your body is, it doesn't mean that there's something wrong with having fibroids. Yeah. But knowing that I can't do this position. So if I'm on top of him and I can control the depth of penetration, and that is not going to cause me pain, because everyone's got different whoever's got fibroids have different fibroids in different positions.
Yes.
And it doesn't always cause pain. So fibroids don't always cause painful sex, but heavy periods. Fibroids, heavy periods, and pressure. Okay. PCOS, not really related to painful intercourse. And you mentioned
endometriosis.
Endometriosis is it's there. It's if someone tells me there's painful periods, I ask, is it painful to have sex? Yes. Is there one position that you cannot do? And they were like, oh yeah, I cannot do that. Endometriosis. And then I see it on ultrasound.
My top prescription for aging signs, vitamin C and retinol.
New Lift Active Duo.
In the morning,
Pure vitamin C to boost skin radiance. And at night, pure retinol to boost regeneration. Wrinkles are reduced for 100% of women. 2 actives, 1 prescription. New Lift Active Duo. Vichy, recommended by 50,000 dermatologists.
Okay, so we've got our heads up on a physical. Basically, if there's pain anywhere,
Get checked.
discomfort anywhere, get checked.
Of course.
So if you're embarking into a successful sex relationship and there's pain at any point, go and get checked out.
Yes. And size matters. Okay. I have to say this.
No, I like this part of the conversation. This is great. We've been talking doggy silent side. Chiara, I love you.
But I love you too. But it's true. If someone was having a relationship for 7 years and sex was fine and no problems, no pain, nothing, right? And they have a new relationship and all of a sudden it's painful. And then but is he bigger? Oh yes, he is. There we go.
Yes.
So size does matter. Because then things need to change, because positions need to change, because you cannot suffer pain, because you cannot enjoy a good sex life if you're in pain. Correct me, girls.
Yes.
And if pain is happening, intercourse needs to stop.
Yes.
Rule number 1. Engage in sex in any other form, on shape, oral sex, mutual masturbation, whatever takes your fancy, but intercourse has to stop, because what happens psychologically is that if pain is happening every time intercourse is happening, we create this cycle of anxiety that might be difficult to deal with if the cycle becomes so very much ingrained. So rule number 1 of painful sex is stop sexual intercourse. Anything else that is not painful, because we need to associate sex with pleasure.
Yes.
So if sex is painful, unless obviously we go into BDSM and pain is
Pain
part,
by choice.
pain by choice and by consent, then sexual intercourse rule number 1, it needs to stop until you figure out what is happening by going to the gynae, by going to your GU specialist, by going to your therapist, etc.
So to recap just for a second, I just want to make sure, because I want to be very clear about this. Chiara's dying to jump in there. But we've established, make plans. Communicate. We're going to come back to communication in just a second. Nicola's avidly nodding here. If there's pain, any way, shape or form, stop having sex and get it dealt with immediately for both.
Stop having intercourse.
Intercourse, you're right.
That is painful.
Absolutely. I love the way we've re-clarifying what sex is. So if intercourse is painful, stop immediately from a psychological and a physical point of view and head to the gynae, get yourself checked out and find out why.
Wait till the next day, ideally. Don't come there and then head to the gynae. You say head to the gynae.
Okay, 11 o'clock at night, let's go to Dr. Chiara and get checked.
I know why Chiara's saying that. I totally understand. Okay.
But going back to the painful intercourse, one thing I recommend is having sexual intercourse. So at the end of pregnancy to initiate spontaneous labor. Okay, nature is beautiful. So basically, in semen, there is this prostaglandin, which is the hormone that can start contractions and dilatation of the cervix. And of the female orgasms, then there is oxytocin that is produced and contractions start. So all these things do help.
Sorry, you keep saying this stuff, and I'm like, I'm nearly half a century old and I've never heard this before.
Yeah. So yes, at 36 weeks, this is what I encourage my pregnant ladies to do, to engage in sexual activity, because this helps start spontaneous labor. It's very important. But because of the uterus, because of the position, because of the joints, then pain can be an element. And I iterate this because obviously if it's not enjoyable, if there's pain, and obviously the male partner doesn't want to cause pain to the woman he loves, despite this being a natural thing, and that is actually required to start labor, then I tell them to stop, because obviously this you cannot push on that, you know. I explain other ways. As long as the semen is inside the vagina, there's no need for the intercourse, the penetrative act. But yes, we forget that sex during pregnancy is a normal thing, and pain can be an element of that because of everything changing in the body.
But generally the rule is if it's painful, don't.
Exactly.
I'm going to come to Nicola. We've talked about now a whole bunch of issues, but one thing that keeps coming up in my mind as we're having this conversation is communication.
Yeah.
And I think one of the reasons that, to bring all of this together, whether it be this psychological aspect of triggering, of going around this cycle of painful sex, and then what happens to you, whether it be that you're having sex and it's painful and it shouldn't be painful because maybe there's something wrong or whatever, it comes down to communication. And communication is exactly why we're having this conversation. And communication can be very, very difficult. Yes. It can be difficult to sit down with your partner and discuss this. It can be difficult to tell your partner that it's painful because you don't want to let them down. And also, that might happen when you're in the throes of having wonderful sex and you've gone to it, you've put it in your diary. So your Google Calendar is red with sex alerts, and you booked a hotel and you've gone there, and suddenly you're in a position and it's painful, and maybe we as women don't necessarily want to express that. Let's talk about successful sex from a communication and psychological point of view. We talked about these triggers, and I'm guessing that if you are experiencing triggers, go and talk to somebody about that as well, because triggers mean that there was something there, something's happened, there's some trauma that's creating this issue. Is that the best thing to do? Is that all we're going to say, is just go and talk to someone?
Yes. I mean, this applies to us in general, not just about sex, but
absolutely,
we can at any point be triggered by a memory, a difficulty, an experience that was negative in the past. So definitely talk about that. But it's also important for me, I talk about this when I work with couples in general, or when I'm even communicating with people that are in relationships, that a lot about having a healthy relationship is navigating each other's triggers. This is in general. Understanding how to not, enrage my partner by bringing up a topic that's really sensitive, or how to, it boils down to respect and communication. So then when you're bringing in the complexity of such a sensitive subject like sex, it's even more important that we're comfortable enough to say, I I'm not there yet with you touching my back because that takes me somewhere. Or I'm not comfortable with going straight into penetrative sex. I need some time. If I'm not able to communicate that, I probably shouldn't be engaging with a partner that isn't ready to listen to this kind of conversation. So communication is super important, but it's also about me being able to understand that it's absolutely okay to talk about this. And it's absolutely okay, just like I said last time, to withdraw consent in the middle of sex, whether it's a one-nighter, whether you're married, whether it's a long-term relationship, because things can come up. And the more we are, as a couple, healthy in communication, the easier it is then to bring this up when it comes to sex, which is, as we're saying, more complex. But it doesn't need to be. It doesn't need to be a shameful topic. And the more direct we are about it, the less likely we will have difficulties with bringing it up at a later stage. So straight off the bat in the relationship, as we mentioned earlier, talk about it. What are our boundaries? What are our limitations? What are our triggers? What are our yeses and nos?
Coming to you, Anna, just about this, you mentioned in the show that very first show we had about sex, you talked about having that sex discussion, coffee, date. I remember you said, go into a place where you can sit down comfortably. Reiterate that, because it's great saying that we're going to communicate. And I think, wow, what incredible advice. But we've appreciated sitting around this table. That is incredibly difficult. So how do we make that easier?
I think it starts from good communication in general. If you are constantly fighting with your partner, if you are constantly triggering each other, if it's a very high conflict situation, I would question the relevance of what this relationship is adding to my life. So I think it needs to start from there. If usually there is a good emotional connection, then many times sexual communication, talking about sex, comes as an aftermath of that. And again, I am talking at least mainly about long-term relationships, but this is not just with long-term relationships. If it is meeting someone for the first time and having sex with someone for the first time, we need to talk about our boundaries, our triggers, what we like, what we don't like, what we can consent to, what we don't consent to. So this conversation needs to happen.
But I'm going to challenge you. I'm going to challenge all of you, because we've said, yes, in healthy relationships, it should be easy. It should be natural. It should be the aftermath. It should be part of our general conversations. But the very fact that we're sitting down and having this conversation, we know that it isn't.
So acknowledge it. Acknowledge it in the relationship. If it needs to be brought up, we need to have an awkward conversation. And I acknowledge that it's awkward, but I think we should talk about it. And this could be a way today of how somebody listens to this show and says, I'm going to go and I'm going to say, it's awkward, but I need to talk about it. And I need to share this. And this could be about anything, but sex is one of those.
Because this is not working for me anymore.
Yeah.
Because I'm not up to this anymore.
I tell them, get me as an excuse. I tell them, because the guy asked me about sex. So I tell them that, because it starts the conversation. Yes. I go and tell him, Gyne asked me.
Use this podcast.
Yes.
Yes. Oh, wow.
What a responsibility.
Okay. And so are there any heads up, just from very practical points? You said before, make it a coffee date kind of conversation. You sit down and you make it a relaxed environment. How can we do that? Is there anything that you can think of, apart from blaming Chiara, obviously, or me? Thanks a lot for throwing me under the bus. Sorry. Thanks a lot.
I like with every communication and with every conversation, I would say own it. Don't start blaming and saying, because you don't know how to touch me and you don't know what pleasures me and you don't know, you expected sex after we had such a bad fight. Own it. Say, I am not happy in our sexual relationship at the moment. I'm not being satisfied. Own it. Make it yours. Because if we start blaming our partner, the first reaction we're going to get is defense. if we say, this is hurting me, this is not working for me, our partners, especially if we're in a good relationship, will see how to make it better. So own it, make it yours, make it about you rather than blaming and throwing it and vomiting it on your partner or partners.
I love that. I mean, that leads me quite nicely onto my penultimate question.
We're getting there.
Which is, are there any no-nos? Are there any absolute don't do that, guys? That's just a big don't. I mean, you always mention, Nicola, you always mention that no is okay at any time, and that's great. And I love that, and I take that as a takeaway. But are there any no-nos with regards to a successful sex relationship or even communication? Is there any nope, that's not, you should not be doing that?
Probably giving criticism right after having sex.
Ooh.
It's already a sensitive subject. So if I'm going to give feedback to my partner, I would recommend that it would be done kind of mindfully and probably not directly after, so that it's not so, we've just had this intimate moment and I'm being criticized, let's say, on my performance or something like that. So that would be something I would say to keep in mind when to bring a conversation up and how to bring that conversation up. As Anna mentioned, the way in which we communicate is as important or more important actually than what we say, right? Because it's going to be, a lot of us will receive feedback as criticism, or it induces shame, for example. And that's huge when it comes to our sexual relationships, shame. So yeah, that's what came to mind for me.
I think from the anatomical aspect, apart from pain, it's bleeding. So if there's something that is concerning you, if you're bleeding after intercourse, even if it's not painful.
Okay.
If there's, especially in the new relationship, so if there's bleeding after intercourse, do get checked.
Okay. Any no-nos from you, Anna?
Pain is a big no-no, and because before we spoke about intercourse and pain, sometimes it's even touching and pain. Sometimes some conditions make the vulva and the external part of the genitalia very, very sensitive to touch. And so pain needs to be checked. And obviously consent and it's heartbreaking. Sometimes I get women in clinic telling me, we had started, he was really into it, she was really into it, I couldn't just stop in the middle of it. So saying no at any part, I mean, having sex on Monday does not mean I want sex on Tuesday. Removing your top and flirting, and then all of a sudden realizing this is not what you want, is okay to say this is not what I want, independent of whether your partner is aroused or not.
It's one of the really surprising and heartbreaking statistics that I came across in one of our previous shows, that 72% of women have had sex when they really didn't want to. And that's not that they were forced. They just didn't have the courage to say, I'm not in the mood. And I loved what you said in the previous show where you just said no is no is no. This is my last question. I'm going to ask each of you for your closing words of wisdom. Oh, I like it. You see, Chiara, you rolled your eyes, so I have to pick on you first.
Thank you.
Just nominated yourself. Closing word of wisdom.
Know your body, know what you like, and explore more.
I like that.
Yeah, she stole my...
This is trademark.
Roll your eyes.
Trademark, that's what it is.
Yeah, I totally second that. And I would also say that it's common to have difficulties here and there. It's common for things to come up in our bodies, in our minds. So, speaking up about it, seeking out help. There's a lot of different ways we can tackle different difficulties, and there are people there that are willing to help. So don't be afraid to ask for it.
Yeah. Anna, you have the last word of wisdom.
I would say your pleasure is important. As women, we have been in, our sexual pleasure has been suppressed for so many centuries. And I would say to the women out there, your pleasure is important and you should be stamping your feet and asking for it.
I'm going to chin to that. Absolutely. Dang. Fantastic. That's it, we're done. Flipping heck.